Hi there, I'm Rob, the periodontist here at Bluebell Dental Practice. Many of you will have seen me already. You will have been for a consultation, and in that consultation, of course, there was an awful lot of information to take in. So as a result, we've decided here at Bluebell to make a video in which I go through that information again, and that you can then look at it as many times as you like, go back and see what it is that we're going to do for you in terms of examination, diagnosis and treatment. So let's go. So you might remember that I drew a diagram of a tooth inside the mouth, and here is our diagram here. So this is your tooth in the mouth. We've got the crown, which is the part that you chew and bite with, and then you've got the root, which goes into the bone. So your teeth actually, what they need, of course, is big, thick, supporting bone holding them in. And actually, believe it or not, your teeth are not really cemented in. Your teeth are actually held in with a ligament which goes all the way around the tooth, so they're sort of suspended within the socket. Of course, all of this delicate stuff underneath has to be protected, and that's where your gum comes in. So your gum comes up over the top of everything and protects the bone, the ligament and the root underneath. It's at this point here where the gum and the tooth meet together that you've got a slightly weak part of the system. The entire mouth is filled with bacteria. They cover all of the surfaces of the teeth, and at this neck of the tooth here, there's a small gap, 1, 2 or 3 millimeters when you're healthy, and into that gap, bacteria will try to go. Now these bacteria are sometimes unhelpful and sometimes helpful. So if you think about your mouth, it's a little bit like your gut. Some of the bacteria are good bacteria and some of them are really nasty characters. When the bacteria gets stuck into this gum pocket, in some people who are susceptible, they will attack the gum and go underneath. And therefore, this attack means that your pocket gets deeper and deeper and deeper. So it goes from 1, 2 or 3 millimeters to 4, 5, 6, 7 and onwards. Where we get concerned is when our patients have pockets that are deeper than 5 millimeters. We know this because when you try to clean the mouth, you probably can't get down underneath the gum much more than about 3 or 4 millimeters. So when we were doing your examination and I said, listen out for the numbers, any number that's higher than 5 is something that we find is a problem. So what do we find? Well, the bacteria, they go down underneath the gum, and then what happens is you start to lose the bone because the body tries to attack the bacteria and it causes damage to itself. And as it causes damage, your bone starts to go down. And so in people who've got gum disease, we find this sort of thing. The bone starts to pull away from the tooth and you end up with the bone going down, but the gum quite often stays, well, relatively high up on the tooth. You might notice some recession, but generally speaking, the bone is going down and the gum doesn't really follow it. And what you end up with is this big, deep pocket all the way down the side of the tooth filled with bacteria that you can't then get out. Modern gum treatments are very, very structured. Okay, we have 4 steps that we now follow, and those 4 steps are very clearly defined by an international agreement. We have step 1, which I call the 20% step, or for some of you I might have called it the George Best step, which I'll explain in a moment. We have step 2, which is the deep cleaning part. And for those of you who've seen a hygienist before, you might think that you've had some deep cleaning done by the hygienist. There are different sort of levels of deep cleaning. So the deep cleaning that some clinicians might consider to be deep might be different to what I might be doing for you, for example. Step 3, now don't be alarmed, step 3 is surgical treatment, or sometimes I call it fancy stuff. So this is the stuff that we might do if we're finding that there's parts of gum disease that haven't responded to the 20% step or the deep cleaning step. And step number 4 is maintenance. So gum disease never really goes away, but we can control it. And that's something that we always address with our patients once we've done the active phase of treatment. So what are we going to do? Well, you've got gum disease, your bone is going down, you've got deep pockets. Your diagnosis is gum disease. First we have to do step one, and that's actually more for you to do as the patient rather than for us. So what you have to try to achieve is to clean your mouth so well that only 20% of the surfaces of the teeth and gums are covered in bacteria. And to help you do that, we will often send you to the hygienist, who will help you by teaching you how to clean your mouth effectively so that really you're going to get the best out of the treatment. I sometimes call that step the George Best step, because a lot of people want to sort of skip that step and go straight to the fancy things, the deep cleaning and the bone grafting and the gum grafts and all that kind of thing. But the fundamental truth is that if you don't get your own cleaning really brilliant, it's not going to work. George Best was a footballer who very sadly became an alcoholic. He required a liver transplant, and of course, in order for them to do the liver transplant, he had to stop drinking alcohol. And that's the way you have to think of it. There's no point in doing a fancy liver transplant if your patient's going to continue drinking alcohol afterwards. It's just going to fail. The same with this. Unless you can get your mouth really clean to less than 20% of the surfaces covered in bacteria, we're not going to find that the treatment works very well. And we've known this ever since the 1970s and 1980s. So step one is often you'll be sent to the hygienist, often for 2 appointments, and then you must come back to me for the more deeper cleaning, the more active phase of treatment. During the deeper cleaning, I will use local anaesthetic to go into your gum pockets and remove gently the bacteria that are underneath. And when you do that, the body tries to heal. So what we get is a tightening up of the gum around the tooth. When you get the bacteria out from underneath, they seal up underneath. Quite often we treat one half of the mouth at a time, and it can take 2 or 3 months for the healing to have an effect. We then go back and measure the pockets. And what we want, of course, is pockets that are less than 5 millimeters. Your mouth should feel much better, you'll have less bleeding, and at that point we can decide, have we won the battle? Do we think that you're going to remain stable? Can we simply put you onto a maintenance program where you see the hygienist after that, step 4, or do we have to do something else? For a small number of people, they might have, for example, a defect in the bone, which means that the gum doesn't heal very well around the tooth. We do have techniques where we can actually put a little bit of bone into the area where the damage has occurred. And in doing that, we can actually get the tooth to be resupported. We can actually grow bone around your teeth again. We can't grow all of the bone back, sometimes just modest amounts, but actually it can make a massive difference to the longevity of the tooth. Sometimes we might just have deep pockets, but the bone might not have any big holes or defects in it. And sometimes we use the laser, or we use minor surgical techniques in order just to reshape the gum so that any of this diseased gum that isn't really sticking onto the tooth is put down close to the bone, and then you don't have a deep pocket there anymore that you can't clean very well, or the hygienist can't clean. And so when we talk about surgical stuff, step 3 treatment, not many people go on to have that done, really. So don't worry too much about it. It's the sort of thing, we keep it up our sleeve if we need it, we cross that bridge when we come to it. Now, gum disease is something that you'll live with all of your life. It's a condition a bit like diabetes or high blood pressure. It never really goes away, but you can control it. And the best way to do that, we find, is with regular hygienist visits every 3 months and regular reviews with me, sometimes every 6 months, sometimes every year. So that's the fundamentals. Hopefully, that will make things a little bit easier for you. Step 1, get your cleaning really, really good. It's probably the most important step. We are here to help you do that. Step 2, you must return to me after the hygienist appointment so I can do the deep cleaning of those hard to reach areas in your mouth. Step 3, maybe the use of a laser, maybe some bone grafting, something to repair your mouth. Almost everyone will have step 4, which is maintenance with a hygienist. I hope that's helped. Do re-look at the video at any time that you want to. If you've got any questions, ask us here at Bluebell. The whole team are ready to answer your questions and to make sure that you understand as much as possible about what's happening to you, what we can do about it, and what the end result is supposed to be. And I look forward to seeing you for your next appointment soon.